Welcome to the Richmond Center for Christian Study. The mission of the Richmond Study Center is to bring gospel transformation to individuals and communities within the greater Richmond area by fostering serious consideration and discussion of biblical worldview and how that worldview speaks to every area of life and culture. For more information about the Richmond Center for Christian Study, visit us on the web at richmondstudycenter.org. This is the third in a three-part video series entitled Reforming the Healthcare System: How a Biblical Worldview Bears on the Current National Debate. In this segment, the panel will take questions from the audience. Our panel includes Dr. Michael Murchie, Assistant Medical Director of Crossover Clinic in Richmond; Dr. Donald R. Stern, Richmond Area Health Director; and Dr. Terrell Wade, Board Member of the Richmond Center for Christian Study and a retired family physician.
I work for myself, I work at home, so I listen to a lot of radio, and it's talk radio. So I'm a little, colored by what I hear. One of the problems that I have with the current the way the government wants to be handling the issue of health care, or I think now it's health insurance reform. They don't want to call it health care reform. It's all about the insurance. Is with the public option, as you were talking about, that ultimately the real goal is to drive the private insurance companies out of business, because the way they have the wording that the government sets the standards, the government decides what is to be offered, who's to get it, blah, 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 and that the private insurer has to meet those same standards that the government sets up. But of course, the government will not be working for profit, so they don't have to worry about it. They can print money, and the insurance companies can't. So the insurance companies have to offer the same or better than the government offers, but they have to do it at a price that they can still make a profit at to stay in business. Do you see that as an actual hidden goal? And I don't mean to be political about it, but obviously something is going to happen to the insurance business if what is currently underway goes through. So,
first of all, let's make sure we keep this in perspective. About 20% of what's related to our health, and I think it was mentioned earlier, only about 20% has to do with access to medical care. About 50% of premature deaths are really related to our own choices, our own behavior, and about 30% is what could be called the social determinants of health. Health policy, where we live, clearly until the 60s, your race. There are a number of social determinants that we as an individual don't have control over, but are a function of the community we live in and the policies that impact where we live and how we live. But 50% of premature death is a function of personal choices that we make. What we smoke, what we drink, what we eat, whether we obtain the vaccines that we need to protect our health, whether we practice promiscuous sex or not. A number of those life choices that protect our health. It was mentioned about obesity earlier. We got this tremendous epidemic in obesity in America with a growing sedentary lifestyle, with a reduction in the amount of physical activity and PE. Remember, some of us, I can remember PE in school, you put on shorts and you got out in the field or you worked on the court. Not anymore. So all this healthcare debate is only about 20% of what really impacts our health. And it's amazing how much money we put into this. Now, we call it healthcare, but it's really illness care. Only about 1 to 3% of the dollars in the medical care system really go towards prevention or preventive health. The rest of it is really illness care. So just to put it in perspective. And yes, I think that it's possible that, I don't know if it's intended necessarily that the public option is to drive out all private medical care. Of course, the conservatives view it that way. Liberals view it as one in which it's necessary in order to provide competition. It's kind of an interesting switch and bait. But think about it this way. If you're an employer and you've got an opportunity to, well, in the past you had an opportunity to purchase health care insurance or illness care insurance for your employees or not. Now you're going to be required to do it. If you don't purchase health care for your employees based on a certain set of standards now that come down from above, you're going to be, it's not called a tax, it's called a, a surcharge, right, it's a surcharge. So let's see, if the surcharge is only 8.5%, but my health premium for my employees is going to cost my business about 11% of my profit, heck, you know, I'll pay the surcharge. Guess what? Then you shift healthcare from an employer-based competitive market with certain private insurance providers to the healthcare, you know, whatever the new government program looks like. So I think it could go that direction, absolutely.